is smooth muscle tumor of the uterus, most common pelvic tumor in women, and are estrogen dependent, meaning they grow with the hormonal stimulation. Hormonal influence. Estrogen and the progesterone stimulate the fibroid growth, enlarge during the pregnancy, shrink after the menopause. Genetic factors. Family history increases the risk of first-degree relatives associated with the MET1 gene mutation. African American ethnicity, higher prevalence, earlier onset. Obesity, increased estrogen production. Early managed, nulliparotic, prolonged estrogen exposure. Polycystic ovarian syndrome, tamoxifen use. Types of the uterine fibroids. Intramural fibroids, most common within the myometrium, causes the heavy menstrual bleeding, menorrhagia, and the pelvic pain. Subserosal fibroids project outward from the uterus into the peritoneal cavity, can cause the pressure symptoms, urinary frequency, and the constipation. Submucosal fibroids, least common but most symptomatic within the endometrial cavity, causes the severe menorrhagia, infertility, recurrent miscarriage. Pedunculated fibroids attached by a stalk, either subserosal external or the submucosal internal, can undergo the torsion, causing the acute pain. Clinical features like menorrhagia, heavy periods, most common symptom. Pelvic pressure pain due to the uterine enlargement. Urinary symptoms, frequency, urgency, fibroid pressure on the bladder. Constipation, large fibroids compressing the rectum. Dyspareunia, pain during the intercourse, common with the posterior fibroids. Infertility and the recurrent pregnancy loss, most common with the submucosal fibroids. Bimanual examination, enlarged, irregularly shaped and the firm uterus. Transvaginal ultrasound, first-line imaging identifies the location, size, and the number of fibroids. MRI, gold standard for the complex cases, used in the surgical planning and to differentiate the fibroids and the adenomyosis. Hysteroscopy for the submucosal fibroids affecting the endometrial cavity. Endometrial biopsy done if post-menopausal bleeding or the atypical presentation suggests the malignancy. Management of the uterine fibroids. Medical management, first line for symptom control, not curative. NSAID, ibuprofen, naproxen, pain relief. Tranexamic acid reduces the menstrual bleeding. Hormonal therapy, combined oral contraceptive, regulative bleeding, progesterone, GnRH alternative, selective progression receptor modulators. Reduce the fibroid size. Surgical management, myomectomy, fibroid removal. Hysterectomy, definite treatment and in severe cases for women not desiring future pregnancy. Uterine artery embolization, minimally invasive procedure, cutting the blood supply to the fibroids, not recommended for the women planning the pregnancy. MRI guided the focused ultrasound immunotherapy, non-invasive, uses ultrasound waves to shrink the fibroids. Complications of the fibroids, severe anemia due to the menorrhagia, infertility and the miscarriage, especially with the submucosal fibroids. Degeneration, ischemic necrosis causing the acute pain. Torsion, in pedunculated fibroids leading to the severe pain. Urinary retention and constipation due to the pressure effects. Malignant transformation, leiomyosarcoma suspicion of the rapid growth in the post-menopausal women. Fibroids, leiomyomas, or the mentioned in estrogen-dependent smooth muscle tumors of the uterus, most common pelvic tumor in women, least incidence in the African American women. Intramural fibroids are the most common type. Submucosal fibroids causes the most bleeding. Menorrhagia and the pelvic pressure are the most common symptoms. Enlarged irregular firm uterus and the bimanual exam is suggestive. Transvaginal ultrasound is a first-line diagnostic tool. MRI is the gold standard for the surgical planning and differentiating from the adenomyosis. GnRH agonists restrain fibroids but are not a long-term solution. Myomectomy is preferred for women who want a future pregnancy. Hysterectomy is a definitive treatment. Uterine artery embolization is effective but not recommended for women desiring the future pregnancy. Rapidly growing fibroids in post-menopausal women may indicate the malignancy. Leiomyosarcoma.